Thank you for watching the video. This is YouTube Medical University. How are your heels? Are they dry, flaky and shedding powder? Do you have deep cracks or vertical lines that seem ready to split? Are there any of you like that? Maybe you think it's just dry because it's winter, or that your skin has gotten harder because you've gotten older, so you just leave it alone. But what if that carelessness is causing you to miss a dangerous sign? Actually, from a medical perspective, if your heels are extremely dry or unusually hard, it might not just be a skin problem, it could be a sign that your internal organs are crying out for help. Especially if any of the 5 diseases I'm about to introduce are hidden, if you try to scrape off the calluses on your own, or continue with the wrong care. In the worst case, it could lead to a condition called gangrene, where you might lose your toes, or it could even become life-threatening. You might miss signs of conditions like myocardial infarction or kidney failure. So, in this video, based on evidence from scientific papers, I'll talk about the serious signs of illness that can be detected from dry heels. And I've summarized everything about how to identify these signs and what kind of care you should do to improve dry heels and save your feet. Please watch until the end. Here's today's agenda. First, in the first section, I'll talk about what appears on the heels. I'll introduce 5 serious diseases. Then, in the second section, I'll talk about the most effective foot care based on scientific evidence, as well as actions you should avoid. YouTube Medical University wants 1 million subscribers by year end. I'd really appreciate your subscription. So first, in the first section, why is heel dryness considered so important? The reason is simple. Actually, the heel of the foot is the part farthest from the heart. That's why it's the first place where abnormalities in blood flow, nerves or metabolism appear. Let's uncover the frightening truth behind each. The first of the 5 diseases behind dry heels is this. It's diabetes. What's scary about diabetes isn't just high blood sugar, but the fact that it gradually damages your nerves. Many people think that dry soles are caused by a lack of moisture. However, one of the most important factors that keeps your feet moist is actually sweat. When you develop diabetes, a nerve called the autonomic nerve gets damaged. As a result, the command from the brain to sweat doesn't reach your feet. In a study conducted in India, they actually gathered diabetes patients and when they examined the sweating function, the ability to sweat, they found that about 60% of the patients still had intact sensory nerves in their feet, but their ability to sweat was impaired. Even if you have diabetes and think you're fine because you don't feel numbness in your feet, if your feet are already rough and dry, it could mean that nerve damage has already started. And something you absolutely must not do is scrub your heels hard in the bath or shower. You know those heel scrapers you see at hot springs and such? If you have diabetes, please be careful. When you have diabetes, your immune system tends to weaken easily. Wounds heal slower, and infection risk from bacteria increases. So if you scrape your heels yourself and make small wounds, they might not heal, bacteria can get in, and it can quickly become infected. While working in the emergency department, I saw ambulances bring in cases where a minor toenail cut became badly infected. Pus built up and the foot developed gangrene. In other words, it started to rot. That's the kind of condition it became. I saw many patients with diabetes. There was actually a patient like that, a man in his 60s. He came to the outpatient clinic saying that the dryness on his heels and feet was really bad and asked for a strong ointment. However, when I touched his feet, they felt unusually cold and the pulse in his feet was weak. I suspected it was more than simple dryness, so we did some tests. He was diagnosed with severe diabetes, and not only that, blood flow in his feet kept worsening and his blood vessels were nearly blocked. If he had judged his heel condition himself, it could have been scary to imagine what might have happened. Please be careful. Serious conditions can hide behind dry heels. The second condition is arteriosclerosis in the blood vessels of the feet. Like the man in his 60s I mentioned, blood flow there is nearly cut off. At times like that, dryness actually appears as well. It's easier to remember if you think about the reason. As arteriosclerosis advances in foot blood vessels, they harden and accumulate fat, eventually narrowing. As a result, the blood flow that reaches each cell in the feet becomes insufficient, so there isn't enough nourishment to keep the skin healthy. As a result, the skin dries out, a condition medically known as nutritional disorder changes. According to the American Heart Association guidelines, clogged blood vessels in the feet cause the skin to thin, lose luster, and dry out. These symptoms are part of the diagnostic criteria. As leg arteriosclerosis worsens, you may notice dryness along with symptoms like calf pain that eases with rest, so please be cautious. If your toes are very cold and you lose hair on the tops of your feet, these symptoms may indicate more than just a foot problem. It could be a sign that arteriosclerosis is gradually progressing in the blood vessels of your heart and brain as well. If you think this might be the case, please consider visiting your regular hospital or a cardiology department. The third of the 5 diseases hidden behind heel dryness is uremic dryness. It sounds like a complicated term, but it's actually simple. When your kidneys become impaired, it can also cause dryness. Many people may not know about the connection between the kidneys and dryness. Actually, our kidneys usually produce urine, right? When the kidneys become impaired, it becomes harder to pass urine, and toxins that should be eliminated start to build up in the body. This condition is called uremia, and when toxins build up in the body due to uremia, it can cause itching and damage the skin's barrier function, making skin problems more likely. There is some data on this. According to a highly reliable review that collected data from multiple people whose kidneys had deteriorated to the point where they needed dialysis, between 54% and as many as 91% of dialysis patients experienced severe skin dryness. Dry heels can indicate poor kidney function, as they may be affected this way. This is possible. Poor kidney function can cause dryness and other symptoms, so watch for them. Your feet may also be swelling more recently. Your urine has started to become foamy. You have started waking up several times at night to go to the bathroom. How about you? Do you have any symptoms that come to mind? In the past, I have also posted videos about kidney disease and signs that your creatinine levels or the blood vessels in your legs are about to get clogged. If you're interested, please check them out from the description below or the card at the top right after this. At YouTube Medical University, as a practicing physician, I share data-based health information you can use starting tomorrow. I share accurate information. It's very important to have a reliable source of information. I would be truly happy if you could subscribe to the channel. Here is the 4th of the 5 diseases hidden behind dry heels. It's a thyroid disorder. Do you know about the thyroid gland in your throat? This small butterfly-shaped organ weighs around 10 grams and plays a vital role. The thyroid hormone it produces regulates the body's metabolism. This hormone acts as an accelerator to make your metabolism more active. If this hormone decreases, the accelerator for your whole body won't be pressed. The turnover of your skin, that is, the process of your skin renewing itself every day, also slows down. As a result, old skin remains on the surface longer, slowly deteriorates, and dries out, making you more likely to develop dry skin. In a study involving 460 people with thyroid disease, it was found that those with decreased thyroid function, remarkably, about 57% of patients showed obvious skin dryness. In other words, that's more than half of the people. If you are feeling anxious and you have symptoms other than dry skin, please consider visiting your local clinic or a hospital that specializes in thyroid or endocrine disorders. First, you've recently become more sensitive to cold. Second, your face or whole body tends to swell easily. Third, your hair is now dry and rough, your eyebrows are thinning at the edges, and you feel tired and sleepy no matter how much you rest. If these symptoms appear together with dryness of your heels, then it might not just be simple dryness. There's a possibility that your thyroid function is declining. The 5th disease that could be hidden behind dry heels is this: keratotic athlete's foot. Keratotic athlete's foot. It may sound complex, but it's simple: a fungal skin infection. If you're unfamiliar with it, you might easily overlook it. When you hear athlete's foot, don't you picture something itchy and oozing? The skin between your toes gets soggy and peels. That's the usual image, right? However, there's also a type of athlete's foot where only the heels become rough and dry. This is called hyperkeratotic tinea. This type has very little itching, and just by looking at it, it's hard to tell apart from regular dryness. And there's also a possibility that it can be missed with just one examination. When data from 460 patients was analyzed, for patients who were tested by a doctor to see if they actually had athlete's foot and the result was negative, in other words, the probability that a negative result truly means they don't have it is about 73%. In other words, there's a possibility that about 30% are missed. So if the roughness on one foot is really bad even after applying ointment, or if someone in your family has athlete's foot, or if the athlete's foot spreads not just to the heel but also to the nails, causing them to become white and thick. If any of those conditions apply to you, please consider seeing a dermatologist. When you treat athlete's foot, the dryness will go away almost like magic. So in the second part, I think this is something everyone wants to know right away. What kind of care should you take for dry feet? Also, I'll introduce things you shouldn't do. First, let me introduce 2 things I don't want you to do. Here's the first one. As I mentioned earlier, it's shaving the dry skin on your heels by yourself. As I said before, I'll keep it short. Please never do this. Even international foot disorder guidelines advise against it. Removing thickened skin at home by yourself is not recommended. As I mentioned in the first lecture, people with diabetes are more prone to infections and their wounds heal slowly, so things can easily get worse. For those with advanced arteriosclerosis and poor leg circulation, even a minor, when an infection occurs from a wound, the immune cells that protect the body from bacteria can't gather because of the poor blood flow. As a result, it's called gangrene and the tissue can easily rot. So, especially for these two types of people, please make sure not to shave your own heels by yourself. And the second thing you shouldn't do might actually surprise a lot of people. It's very important to keep your feet moisturized, but I don't really recommend applying moisturizer thoroughly between your toes. This is from the perspective of protecting your body from athlete's foot, which I talked about in the first part. It's fine to moisturize your heels thoroughly, but when it comes to between your toes, it's actually better if they're a little on the dry side. If you apply cream between your toes, it tends to trap moisture. Athlete's foot, or tinea pedis, thrives in moist environments, so this increases the risk of infection. In fact, even in the guidelines for foot complications caused by diabetes, it is clearly stated to avoid applying moisturizer between the toes, so please keep that in mind. So, what kind of cream should you actually use and how should you apply it? Can you treat or prevent dry feet? Let me introduce some recommended care methods. The main product for moisturizing is this one. It's urea. Some of you might be wondering, what is that when you hear urea? Actually, creams containing urea can be prescribed at hospitals, and they're also sold at regular drugstores. In fact, this urea cream is the most recommended for rough and dry feet. Actually, urea has two very beneficial effects. First, the skin on the heels of your feet tends to get thicker and thicker. Urea helps dissolve the protein that accumulates in that thickened skin. And that's the effect of urea, but that's not all. Urea also forms a barrier that prevents moisture from evaporating from the skin, giving it a powerful moisturizing effect. A study conducted at 19 facilities in Europe focused on people with diabetes who had deep cracks in their heels. They compared a group of patients who used a specific moisturizer containing urea for 4 weeks with a group that did nothing. As a result, the percentage of people who still had severe heel cracks was lower in the group that applied urea cream for 4 weeks compared to those who did nothing. The group saw a 25% reduction in the number of people with dryness. When buying this urea cream at a drugstore, please keep these points in mind. If your main concern is rough and dry skin, please choose a cream that contains more than 10% urea. And for those with extremely thick and hard heels, please choose a cream that contains more than 20% urea. However, there's one thing to be careful about. If you've used it before, you might know this, but urea cream tends to sting when applied to wounds. If the cracks in your heels are deep and you feel a stinging pain when you apply it, I recommend not forcing yourself to use urea cream. Instead, switch to something less irritating, like white petroleum jelly. And another important point is how often and when you apply it. Are there people who think that applying ointment once a day is enough? Actually, it's said that for stubborn heel dryness, it's important to apply it twice a day. In many clinical trials as well, treatment for heel dryness was done twice a day. With many research reports, it's recommended to apply it twice daily if you're seeking medical effects. And what's especially important is that I want you to apply it in the morning and evening. For those who take a bath in the evening, make sure to bathe thoroughly. Please make sure to moisturize within 15 minutes after getting out of the bath. After bathing, your heels are full of moisture and in their softest state. By applying urea at this timing, it penetrates into the keratin, dissolves the dead skin cells, and forms a barrier to prevent further moisture from evaporating. And it's also important to protect your feet by wearing socks after applying the cream and to try to maintain humidity. If you have stubbornly dry heels, please try using urea cream and make sure to apply it twice a day, especially within 15 minutes after taking a bath. If there are any other things you've tried, please let us know in the comments section. How was it? Let's review what we've covered so far. Earlier, we discussed 5 surprising diseases behind dry heels, like diabetes-related dryness that stops sweating and leg arteriosclerosis. Sometimes kidney function suddenly drops, causing uremia and dryness, or thyroid function decreases, slowing metabolism and drying the skin. We also discussed patterns like athlete's foot, often missed, where dryness results from a fungal infection. If you found this interesting, I would really appreciate it if you could hit the like button. To make sure you don't miss any new videos and don't forget which channel this is, please subscribe. I'll see you again in the next video. As a general practitioner, I've learned from my patients about how to live without aging from your 70s onward. I want to live like this too. I never knew there was such a way of living. These stories are filled with lessons I've learned from many patients. Is socializing with friends more important than exercise? Is reducing medications better than adding more? This shares seniors' advice for a healthy, happy life at any age. See the description below.